Good morning. My name is Batool Hussain, and I'm a third year pediatric emergency medicine fellow at Children's Hospital of Michigan. I'm here to present my poster on the evaluation of advanced practice provider related return visits to a pediatric emergency department and their outcomes. Return visits to the emergency department have long been considered a key indicator of the quality of care provided during the ED visit. While multiple studies have evaluated physician-related return visits to pediatric emergency department, there is limited data looking at advanced practice provider-related return visits. Furthermore, the existing literature deals with only crude return visit rates and other quantitative data, but does not elaborate on the qualitative data like clinical outcomes and description of the provider errors that led to these return visits, which in our opinion may be a better reflection of the quality of care provided. With increasing number of advanced practice providers working in pediatric emergency departments nationally, there is a need to monitor and assess the impact on the quality of care provided in these settings. The objectives of our project was to describe advanced practice provider related return visits to a pediatric emergency department and their outcomes, as well as to evaluate the causes of these, specifically those resulting from diagnostic errors and their associated clinical impact on the patient. We performed a retrospective review of 72-hour return visits at an inner city level 1 trauma pediatric emergency department from January 2018 to December 2019. The return visits, where care was independently provided by an advanced practice provider during the index visit, were included. While the return visits whose presenting complaint was unrelated to the index visit, which had an index visit for mental health screening, or where the patient left without being seen or completing treatment, were excluded. Data on patient demographics, index and return visit characteristics, including interventions performed and outcomes of these return visits, was extracted. Reasons for return visits were characterized as progression of illness, medication-related, or callbacks. Index visits were then assessed for any diagnostic error made, impact of which to the patient was classified as none, minor, or major. Descriptive statistics were used to summarize study sample using frequency and rates. The advanced practice provider related return visits to our ED in our study was 2.1%, and 462 eligible return visits were included in the final analysis. Majority of these return visits were for medical reasons, had lower acuity patients, and were secondary to persistence or progression of illness, with viral illness being the most common diagnosis. 12, that is 2.6% of these return visits were secondary to callbacks, 8 radiology, and 4 due to false positive blood cultures. As you can see in the figure on the right, there were 14 return visits that were secondary to diagnostic errors being made in the index visit. That is about 3% of all encounters were secondary to diagnostic errors. These errors included 7 missed fractures on x-rays, 2 missed ocular foreign bodies, 2 missed corneal abrasions, 1 incorrect interpretation of test, 1 missed radiopaque foreign body on abdominal x-ray, and 1 overdiagnosis of cellulitis. 3 of these diagnostic errors resulted in a major impact to the patient. The 2 missed ocular foreign bodies requiring operative intervention, and the 1 abdominal foreign body requiring hospital admission and whole bowel irrigation. So in conclusion, return visit rate for low acuity medical patients seen by advanced practice providers in our pediatric emergency department was low. Though majority of these return visits were secondary to progression of illness and hence unavoidable, a small subset of these were due to provider-related diagnostic errors made and also led to some clinical impact to the patients. Focused interventions targeting preventable causes like radiological and ophthalmological misses could help decrease these errors and return visits in the future. Thank you.